Welcome back, everyone, to the Monmouth Moms podcast. We are here today at Bellworks, and so for me, January usually in most years has been very long, and I keep seeing on social media they're like it's January 45th, and I can kind of relate, but for some reason this year I don't know why January flew. I don't know if it's because we're busier. There was snow last week, and it's just been like the first couple weeks were a fog, but it's next week is February, which is crazy. And I also don't know if that's something about getting older, and just they say that because it's more about perspective. When time goes by more quickly, it's because you have more years behind you. When you're a kid and you're waiting for summer to come, it takes forever because you don't have the same perspective about how quickly time goes by. Something like that.
Yeah.
I don't know. But it does feel like time is just racing by. I don't know why. But anyway, we're here at Bellworks. We are getting ready for all kinds of fun spring events. So I'm actually going to be doing a special podcast about the Monmouth Mom Summit that's coming up in April 11th, coming soon, to just kind of discuss a little bit more at length about our mission, about our panelists, speakers. I'm really excited about the summit and all of the incredible women that are coming together to make this event really special. So look for that soon. But today we have a very special guest. I'm so excited to discuss everything. We were just kind of chatting in the lobby here. So Dr. Mann, thank you so much, from Juvenate Medical Wellness and Rejuvenation Center and West Long Branch, and also Toms River.
Correct. Yes, I have 2 locations.
Thank you for joining. You are a functional medicine doctor. Tell me where you're from.
So I grew up in Edison, in New Jersey, Jersey girl, born and bred. I went to J.P. Stevens High School, graduated from there, and then went to Rutgers for undergraduate. Went to medical school also in New Jersey at Robert Wood Johnson Medical School, and then did my residency in Newark at UMDNJ, and then my fellowship in neuroradiology at Mount Sinai in New York. So after that, I came back to Jersey for my first job, and practiced neuroradiology for many years, which is completely unrelated to what I do now.
So that's nice. You didn't have to do any, I mean, maybe it is, maybe it's not, but you stayed pretty much in the tri-state area throughout the entire, because that's not always the case. Sometimes they do, you do a fellowship in a completely different part of the country, depending on, I guess, what you get accepted into.
I actually was planning to do my fellowship in California, and found out I was pregnant right before I was supposed to leave.
Okay.
And then decided I wanted to be near my parents, and my mom can help with the baby and all those things. So it completely changed the plans, and I ended up in New York instead.
Oh, very nice. So where did you practice in the early stages of your of being a doctor?
I was up north in the Somerset, Somerville area, and with Associated Radiologists. It's a big radiology group up there. And then I moved down to Toms River and was practicing radiology down in that area until 2013, when I had my anaphylactic reaction to contrast while I was doing a procedure on a patient, and had a very, very severe reaction that ended up in the ICU, intubated for weeks. And when I got out of there, we decided, my husband and I, that I think, me being around is a lot more important than continuing my radiology field. So I ended up stopping radiology completely at that point. I could have done some of it from home, read remotely, but I was a procedure person. That was always something that I loved to do. And so when that wasn't an option anymore, I sort of pivoted and said, I have to do something else with my life. I actually thought I was done working at that point, and just thought, let me get my health back on track. Being in the ICU intubated, as we mentioned earlier, is takes such a toll on your body, and the muscle loss and wasting that happens so quickly, regardless of your age, is astounding. Actually, I was shocked to even see the difference in what 2 weeks of lying in bed, and doing nothing can do to your body.
Wow.
So just trying to find my own way back to health was a journey for me. And the way that I discovered functional medicine, I'd never heard of it before. 2013 was my first exposure to even those words. And I went to this conference in New York it was a wellness integrative health conference. And there were some booths there. One was from the Institute for Functional Medicine, the IFM, which is one of the big functional medicine organizations. And so there were a lot of physicians that were in, part of that organization, and so I liked that it was very scientific based, and they presented data and studies and all those things that physicians like to look at to make sure that whatever they're learning makes sense and has data behind it. And so I joined the organization, did my training through them, and then got certified through them as well. So, a lot of people practice functional and integrative medicine. I think the certification adds something to it, just in terms of some basic knowledge that you make sure, that a provider or a doctor that you're seeing has,
Right.
Which I think is important. And so after that, in 2015, I opened my practice in West Long Branch.
Okay.
And started seeing patients. And I love it. I never thought I'd end up from radiology to functional medicine.
Yeah, it's
but
a big change.
Big change. But what I find I like about it is that it is data driven to a big degree, meaning I don't like to guess on what's going on with people. I like to test and try to figure out what's happening based on their symptoms. I find that people can have very similar symptoms, but different causes for those symptoms.
Mm-hmm.
So just going by symptoms and trying to treat that is just not the way to treat the whole person. And so I do blood testing, I do a lot of stool testing, I do hormone testing.
Mm-hmm.
And that forms the basis of any patient that comes in to try to figure out what's going on. I mainly see women, probably 95% of my practice is women. And it's not by accident, probably just because I relate more to them, and I also have gone through a lot of the same things that women that are seeing me are going through. So, hormonal issues, weight concerns, thyroid, fatigue, chronic headaches, a lot of the symptoms that people will come in and say, I went to my primary doctor and, they gave me this pill and it's helping, but I had these side effects. I'm not really feeling great still.
Right.
So I try to look at the whole person. Gut health is such a big, big part of
I'd love to learn more about that. Let's talk about that a little bit. So let me ask you, when you were in med school, I had a dietitian on the podcast once, and I think this came up a little bit about how many physicians go through med school and they really only take one nutrition course. And, there's not a lot of, linking between diet and nutrition and, what your action and how that's impacting your overall health, right? Depending on, now you were a radiologist and maybe that wasn't something that came up a lot in terms of, treating your patients. It's different, different medicine practice. But have you found that that's shifting now?
So my daughter is a second-year medical student. She's in school in Philly, and so far their nutrition training is non-existent.
Interesting.
I'm hoping that in third and fourth year of medical, she's a second year, so she's just doing basic classes right now, a little bit of patient exposure, but third and fourth year are really where they get the patient exposure. So I'm hoping things have changed now. What I hear though from recent graduates is nutrition is still not the priority that it should be in medical school, and I think it's criminal.
It's so bizarre.
It's bizarre to me that's not, because as I think we spoke earlier about the fact that if you can get your nutrition, your sleep, some of the basic things, exercise, hydration on track, you're already, more than 50% of the way to good health. So
right.
I think that's where we get derailed. And if we don't focus back on those basics, we're never going to feel better if we don't also incorporate those things. So It should be a bigger part of our training. And I don't know why it's not. If I had to, help plan a curriculum for medical students, I would absolutely include nutrition and sleep as, two really big aspects.
Yeah. If you had someone that was, going to a cardiologist and they were, obese and they had all these health issues and they just kind of give them a pill to reduce their blood pressure and stuff. That's kind of just how it seems like it's always been treated and not like looking at the overall patient. So with that, let's get into what functional medicine actually is.
So functional medicine or integrative medicine, a lot of people use those terms interchangeably, which they really are a little bit different, but they both fields look at the whole person. So when I have a patient, for instance, a middle-aged woman that walks in, complained of fatigue, maybe some hair loss, feel like just don't get a good night's sleep, feel tired the next morning. I want to do a full assessment. So we do a big sleep assessment as well as nutrition, because those are such a big part of somebody's actually their good health, and their poor health comes from that, a lot of it. And a lot of times, even though we know what's healthy and what we should be putting into our bodies, the reminder from your doctor who's looking at you holistically and really wants to, get you back on track to good health makes a big difference. And that, that collaborative effort makes a big difference, where I kind of try to meet patients where they are, not where they should be, because where they are right now is what we have to work with, right? And we want to get them to whatever the goals are. And I think, a big part of that is just doing the testing, as I'd mentioned earlier, getting a really good intake and trying to figure out maybe where. So I ask a lot of patients, whatever their age is, whether they're younger, because I do see a lot of young patients, teenagers, 20s, with hormonal issues, acne, fatigue. And they have good reason for it. I mean, a lot of them are in school, they're studying, their hours are crazy. Maybe they're partying with their friends and thinking the next morning they're going to be able to get up and kind of just, go. And after a certain number of years of doing that, they can't do the same thing anymore. Just like we know.
Well, I can't do that anymore. Yeah. That's true. But I remember kind of having the opposite problem. It was just like, nothing affected me. So what type of hormone issues would a teen, like someone in their younger 20s have? Like just hormones being all over the place because of puberty, or?
So sometimes during puberty, women go through so many fluctuations. Puberty is the biggest one, and then peri-menopause is the next huge one. So in that group of who've gone through puberty, a lot of times they'll develop teen acne, even adult acne. I deal with a lot of that, where and most of it, if we can get their gut health to be optimized, their acne improves a lot. So I'm not against using medications. I do actually prescribe medications when needed. I really try never to be extreme in my thinking of this is absolutely no good and this is absolutely the best, because at the end of the day, a variety of things will work for patients. And so I want to use whatever, tools we have. But for young people, a lot of the times they will be estrogen dominant. So you've probably heard that word. It means that they're producing more estrogen than the amount of progesterone, because estrogen and progesterone need to be in balance in the body. So younger women will deal with a lot of estrogen dominance, and that's where things like, endometriosis, fibroids, fibroadenomas in the breast, all of those things occur because they have too much estrogen in their system as compared to the amount of progesterone in their system. So as a very basic kind of thing that I look at their hormones to see if they're balanced or not. And then if they are imbalanced, what do they need to get them back in balance? And it's not as easy as just giving progesterone if they are estrogen dominant. If you don't look at their GI health, look at the bacteria that are in their gut. If you're never going to get them back on track if you don't look at all of those things.
So is it all diet related?
It's not all, but that's a big component of it. And I bring it back to that because a lot of times people don't realize the power they have to help fix their own health, right? So they come see me, and we're gonna talk about that again and again, talk about their sleep again and again. And then if they need hormones, if they need other things to help them, that's where I come in to really figure out what they need, and then what, to provide what they need.
Does I used to talk about sleep a lot more on the podcast. Does sleep vary person to person?
Yes.
Yeah.
The need for sleep varies tremendously amongst people. I mean, there is sort of a minimum, probably 6 hours that, some people will say, oh, I can get by, on just 4 hours of sleep. I'm sorry, you cannot do that, long term. So there's a minimum, I think, of, some people that do well with less sleep and still function and thrive. And that's okay. I need my full 8 hours.
Same.
And if I don't get my 8 hours, I know the next day that I don't feel great. And if I don't make up for it the following night, then I'm going to be suffering.
Yeah. My aunt and I were talking about this. She's an OBGYN, and she, for a long time was crazy hours depending on if she was on call or not. But she's the person that needs that. Like, she can't wing it. And so I was like, how did you do that? I would be like a disaster. And you probably did it too.
Yes. In medical school, residency, fellowship, we, night float systems where you're working all night. We know, we know the data when it comes to people that work at night, and the fact that they have a lot more chronic health issues.
Right.
Even if they're getting 8 hours, but they're getting it in the daytime, their circadian rhythm is thrown off. They're not. They're going to develop chronic illness if they don't at some point, shift back to a normal day-night routine. And we know
And
that
does it
with
have
shift
to be the
workers.
routine, like same time, around the same time each day? Or does it matter? Like, say, I never really do this, but like sometimes on a weekend, if we went out, which is rare, like, and I went to bed at midnight, but I slept till 8, I still feel weird, like the next
Yes,
day.
yeah. So I tell my kids this all the time, and I tell my patients this all the time. 10 to 2 is when you're producing the most amount of your growth hormone. For adults, we don't need growth hormone to grow. We need it to repair, right? So once we're beyond, childhood, when you need even more hours of sleep, if you're not sleeping in that 10 to 2 time period, you've missed out the opportunity for your healing sleep.
Oh.
So even though people will say, "Oh, I'm a 12 to 8," like you just said, yeah, okay, that's great. You're still getting 2 of those hours of healing, but wouldn't it be awesome if you got the full 4 hours, if possible? So I try really hard. I go to bed at 10:30 most nights. My husband gets up at 4:30 in the morning to work out, so he's in bed much earlier. And I do try. I talk about sleep hygiene with my patients all the time. I try to practice what I preach, which is at least going to bed by 10:30 and waking up by 6:37 every day as much as possible. Now, are there exceptions? We were traveling over Christmas, so we were on a completely different time.
Right. All the jet lag and all that.
The jet lag took forever, and as I get older and older, it's like it's harder and harder to get back to a routine.
To recover.
But I think routine is important. We know routine is so important for children. We don't realize the importance of it for adults. We need it as much as they do. It may be a different routine, maybe different hours that we need, but we need routine for us to really optimize our health.
Interesting. How do you feel about the early risers that go to work out, like your husband? I've been trying to be one my whole life. I think I'm just going to throw in the towel that I'm not that person and I need the sleep instead. Like, I'm lucky that I can run after I bring my daughter to school, so that's my exercise time. But I've tried like to get up at like 5, never really 4, maybe once, but like it's just not for me. I can't do it.
I'm with you on that. I don't understand those people. I want to be one of those people. He tries to get me up in the morning. Come work out. It's our time together. I'm like, we'll have that in the evening. Okay. Have a great day. I'll see you later.
See you later. Have fun.
I do my workout right at 8. Depending on whether I'm working or not. Start either at 7 or 8 in the morning, depending on the day. And that gets me going for the rest of the day. I notice if I do it too late in the day, I'm too wired then.
Same. Me too. I can't go to sleep. Yeah. I don't like to do it. And I also hate taking 2 showers. It's like a whole thing.
Yes. Washing your hair.
Yeah. It's like too much. So unless like I had to, but I agree. But I also feel like that when I get things done earlier, I'm more, you get more out of the day. You're more productive. So you see both sides, but it's always interesting to me how the people that get up and do it every day religiously.
They have something. He goes to bed so early, so I would prefer to be up a little later and maybe watch a show and then read my book. So I try really to turn off all the electronics at least an hour before I'm ready to go to sleep, and then I read and minimize the light. So I use the night mode on my iPad because I read on my iPad at night. Those things I think make a big difference. The amount of light coming in is you want to minimize that at night, and it's really, really important to turn off those electronics that can interfere with that. And the blue light, blocking glasses, all of those things help a lot. And so if I have patients, which sleep is a huge concern for a lot of women, we talked about the younger age group with their hormones, but the perimenopausal period, which can really span 40 to 60, it's a long range of when women can develop those symptoms. And if they're not getting enough sleep, a lot of times it's related to low estrogen levels. And so I see that where estrogen dominance is prominent when they're younger. Well, when they're older, it almost becomes the opposite. They're depleted with estrogen. They may still be estrogen dominant just because they now have almost no estrogen and almost no progesterone in their system. And so and progesterone is really important for sleep. So if someone's levels are low, whether they're young or old, they will have sleep issues. And
interesting.
That's a big part of what I look at for perimenopausal women.
Okay. So let's dive into services that you offer, perimenopausal women, and also gut health. I think part of at least maybe treating perimenopause symptoms can be helped with gut health, I'd assume, or no?
You always have to treat the gut first. If you don't deal with the gut first, I ask so many questions in my intake in terms of constipation. So this is one of those things that nobody wants to talk about their bowel movements. I love talking about bowel movements. And the reason is if I know that someone's having a normal bowel movement every single day, not constipated, feels like they're cleaned out thoroughly, I know they're detoxing every day. How do we detox? We sweat out toxins, we breathe out toxins, we poop out toxins. And so if we're not using all of those modalities, peeing out toxins, we want to make sure that you're hydrated enough, that you're pooping every single day. And then sweating is a really big part of it as well. That, we had talked about the infrared sauna earlier. I'm a big proponent for the infrared sauna. In our environment, we're exposed to so many things, so many bad things. We're not even aware of it, the microplastics, the things that in our water, the hormones that we're getting, even in our water supply, the antibiotics. If we're not exercising, you're a runner, that's amazing. I do Pilates. That's my new
You
thing
love
now.
that? Yeah.
My daughter, my 25-year-old, got me into Pilates, and I love it. But I do that. I go on my treadmill. But I need my sauna at least once or twice a week to really get that good sweat. I go in there for an hour, and the infrared sauna has a lot of health benefits along with any kind of sauna. So sweating out toxins is, a big part of what I do for myself, and I tell my patients. I have an infrared sauna at home that I use regularly. My daughter loves it when she's home.
So the ones that you can buy that you can put them in your basement or whatever,
yes.
and they're standing. I've seen those. That's really cool.
You have to be
I love a
careful
sauna.
with them. Make sure you're getting one that has low EMFs. There's a lot of things to look at with those, but as long as you get one that's low EMF and it doesn't have the electromagnetic field exposures that some of them do. You have to, and no off-gassing, certain woods that they're made out of. So it's important to look at the
research,
to research the good ones. But I have a broad spectrum one. So there's near infrared, mid and far infrared. And far infrared is great for detox. Near is great for skin. And I'm like, as much as I care about the inside of, the body, I care as much about the outside and skin health and looking and feeling great. So it helps with all of that. So
I've seen a lot of gadgets and things come out from I was at Best Buy over the holidays and I saw they sell things to put over your face, the red light and stuff. But anytime I get a facial and they do, I never even know what to ask when I go. It's like, what do you want? I'm like, I don't know, one that's good. I don't know.
You figure it out for me.
Yes,
right?
Thank you. But when they do the red light, that's the only ones I notice that I look very glowy and
Yes.
not even glowy, but just bright and very healthy. My skin looks healthy.
Yes.
So that, I've definitely noticed. I'll have to check out the infrared. I haven't done that before. Related to gut health, what is your stance on prebiotics, probiotics? There's a gazillion things out there to take.
We need prebiotic fiber. We need good probiotics. The reason, so if we were in an ideal world where we didn't get exposed to anything bad, no antibiotic exposure, no steroid exposure, none of the toxins in our environment, and all of those things can derail our guts, which is kind of scary because, why is our gut so sensitive to those things? Well, we were made way before all those things were in our environment. So obviously our guts, maybe over time, we adapt somewhat, and people can be in good health by eating healthy prebiotic fiber and getting just probiotics through diet. And those people do great. Okay. But for people that have maybe had a course of antibiotics or were on steroids because they're asthmatic or they had some, upper respiratory thing, their doctor put them on a course of steroids or antibiotics. That wipes out all the good flora as well as all the bad stuff, right? So now your body has to rebuild the good bacteria, and you're leaving it up to chance if you're not doing something to help it, to see what populates in your system. We have to rebuild. Our bodies will automatically rebuild the bacteria, but we can have a hand in choosing what types of bacteria. And so, things like the lactobacillus species that are really, really good, that are the first ones that are wiped out. They're the ones that, you can get in yogurt, for instance. You can get that in kefir and a lot of the
sauerkraut, right?
Sauerkraut has that. So you want the good lactobacillus species, and they're the most sensitive actually to being wiped out of our system. So when I test patients for their gut health to see what their digestion looks like, whether they're absorbing their nutrients, all of that is what I do in a comprehensive stool analysis. And every patient gets a stool analysis that comes in to see me for functional medicine for that. So, I have two sides to my practice. One is the functional medicine side, and then the other one, which deals with hormones and gut health and all of those things. And then there's the weight loss side because, a lot of times, and patients cross over. So I see them for both sometimes. And they're very separate, different visits, but I'm looking at very similar things in those patients. I want to know what their hemoglobin A1C is, to look at what their blood sugar control is. At the end of the day, and I feel like I could talk on blood sugar for hours, but if your blood sugar is well controlled and doesn't spike and drop, precipitously with different foods in your diet, you will be a lot healthier. And, we know as physicians, we know the primary killers, heart disease, cancer, they're all related to blood sugar in some way or another. So people talk about Alzheimer's as a type 3 diabetes, for instance. That's high blood sugar predisposes you to developing dementia. So it predisposes you to developing cancer, heart disease, all of those things at the very basic level have to deal with blood sugar. And so why do I bring up blood sugar? Because if you have good gut health and the proper bacteria that are in your digestive, in your GI system, in your colon, they will help you with your blood sugar control as well. So prebiotic fibers you had asked about earlier, absolutely. A lot of it is, eating asparagus, eating onions. I mean, there's so many foods, that
So you don't have to take a supplement.
You don't have to. But if you're recovering from an illness and you want to rebuild things, then taking a supplement that has really good probiotics as well as prebiotic fiber is a great idea.
Gotcha.
And so
Okay.
with all, one thing when people come in, I tell them what to do, even if they're not here to see me for an acute illness, which is always have a good probiotic available, because if you ever needed antibiotics or some kind of medication that's going to wipe out your good flora, immediately you start taking that as well. And so you will not wipe out the good bacteria, or even if they get wiped out, you will repopulate them a lot quicker and get your health back quicker.
Interesting. I take seed. Have you heard of it? Seed.
Oh, yes, I am familiar with that.
I don't know. I like it. It's been a couple of years, so it's fine, I guess.
One thing I will say about any probiotic or prebiotic is to keep switching it up. You don't want the same strains because your body does kind of get used to it and adapts to it. So I tell my patients all the time, you finish a bottle of probiotics, let's say, switch to a different one with a different list of bacteria in there the next time. And I really like the spore-based probiotics a lot when you're trying to recover good health. They tend to mimic what we get when we eat fresh vegetables and the bacteria that come along with those vegetables. So that's sort of mimicking what we're getting through a natural environment. And then you can switch to different brands and different formulations. If you do one all the time, I do think the body gets used to it, and we need a variety. So variety is always a good idea.
Okay. Peri-menopause. How do you even know that you are going into I don't even know. Is it going into having? Entering.
Perimenopause is this vast time period, and it can begin early 40s. Sometimes even people are earlier, but early to mid 40s is really the age where people start to notice first things like fatigue. They notice things like hair loss. They notice maybe some vaginal dryness, irritability, which is so nonspecific. You could be irritable
I'm
for
mad all the time. I don't know. Am I?
You see those menopausal women sometimes, and they're just they have a frown on their face, and you sort of get this idea in your mind, oh my gosh, I look at them and I think, oh my God, hormones would really probably benefit her,
Oh, really?
Absolutely. I mean, I think, we were talking earlier about, the Women's Health Initiative, the WHI study, the biggest hormone study that's ever been done. And the fact that really derailed a lot of women from using hormones, and a lot of doctors that said, oh my gosh, no, you don't want to develop, blood clots and, breast cancer and this risk and that risk. And a lot of that has been really debunked in terms of, the fact that it depends on which kind of hormone therapy you're using, much more than whether you're using hormones. Hormones are very important for women as they're going through menopause in particular. But to get back to the perimenopause stage, it's the time period when you have so many non-specific symptoms. Sleep concerns start. The minute estrogen starts to drop, women start getting sleep issues. And it can happen early 40s, and they're not thinking that this is related to my hormones at all. That's the last thing on their mind. They're thinking, I didn't get enough sleep. Yes, that's a big aspect of it. I have young children. I'm running around. All of that plays a role, but there may be some imbalances in their hormones that are playing a big role in it. And so without testing, there's no way to know where someone's hormones are. And I like to do something called a Dutch test. It's a dried urine hormone test that looks at not only their estrogen, progesterone, testosterone, their adrenal glands we look at. We look at their melatonin production, a bunch of neurotransmitters to see what's going on. It's not just all hormones. There's neurotransmitters that we make that we need. And so I look at all of that and try to form a big picture of what's going on with them. Because at the end of the day, if you don't treat so I always treat gut first. That's going to be, the first thing we look at and the first thing we deal with. Then we look at their other hormones, like their adrenal, their cortisol production, their thyroid. Everybody, that comes to see me for a functional medicine evaluation, I do a really in-depth evaluation with blood work to look at their adrenal gland and their thyroid hormones, because they could be just slightly off on those. They may not meet the criteria for getting thyroid hormones, but I need to know if that's where they are, because we can give them things to help their thyroid hormone production that don't involve taking actual hormones. So there are things to be done in that age group that don't involve taking hormones, and optimizing their gut health and looking at those things are really, really important early on. But other symptoms, oh my gosh, I mean, there's so many of them. Libido's dropping in your 40s. It's suddenly like, wait a second, like I noticed, I'm not as interested anymore. What's going on? Mm-hmm. So a lot of those symptoms, and they can really overlap with different, hormones sex hormones can overlap with adrenal and thyroid. And how do you know what you have without testing? So I'm a big proponent, of that. And I think it's really important to get the information as opposed to guessing. Mm-hmm. And so I deal with that a lot. Now the biggest thing with hormone therapy is that the bioidentical hormones versus the FDA approved hormones, they all work great. Nowadays, there are a lot of bioidentical FDA-approved hormones. So women don't have to go the compounded route if they don't want to. If they want to use patches, they want to use gels that are FDA-approved. We have ones that are bioidentical now, which is great, because the old studies, the WHI study that I mentioned earlier, for instance, they used horse urine-derived hormones, which, if you even just think about that, does that sound like I want to take horse urine into my body?
I'm okay with that.
And oral hormones, which I don't use at all in peri-menopause and menopause. I use a lot of topical or patches, things like that are absorbed and they bypass the gut, so it doesn't involve your gut metabolizing them. So you can use a lot lower doses of hormones and get them absorbed directly in.
Interesting.
Systemically without going through the gut, because the liver and the GI system gets rid of the majority of the hormone before it ever hits your system.
Oh, wow, that's so interesting. Do you recommend? Most of your patients that they exercise each day?
I like 5 days a week, and the reason is we really need recovery as well. People that exercise too much can actually, cause more damage, because remember, we're producing free radicals and things in our system. Every time we exercise, it's a stressor on the system, but it's a good stressor, because It's telling your body, oh, okay, I need to be able to do this, because this is what my body is demanding of me. So now it's going to work harder to make muscle, right? To make sure that our lung capacity improves. All the things that we need in order to be healthier, exercise helps us get to that goal. But I think people that exercise 7 days a week, it's not that you shouldn't do it, but I think that the need for repair and recovery, the muscles need that. And so I think 5 to 6 days is ideal, and you need that at least 1 to 2 days of rest.
I always notice too, like if I run, I usually don't ever run 7 days, but like the day that I take off, like the following day I always run better, because my body's like rested and I can run longer and stuff. So I'm always interested about that, like whether or not you're really supposed to do that. But I guess it's just whatever works for you.
I think it's individual. You're right. Yeah. I think that some people will do better splitting up, maybe taking, if they did 5 days, splitting it up where there's a day, maybe in midweek and on the weekend that they take and that's kind of normal. But maybe they'll go on a hike with the family instead and do something fun outdoors, or, in this weather, I don't know. I'm like not
move your body differently.
Exactly.
Essentially. Clean the house. That's moving.
Yeah, that's moving as well, right? You're doing too. You're actually getting the benefit of a clean house along with having moved your body. So it's a double benefit, which is awesome.
Let's talk about moms and weight loss and how you can help them.
So I see, it seems sort of like a natural, first of all, I deal with a personal family member of mine that deals with weight a lot. So it was really more of a passion project for me to try to figure out, because I can help them with the functional medicine aspect, the wellness aspect of it, but sometimes the weight still doesn't budge, which is amazing. That a lot of times they'll be eating healthy, and it's something to do with their metabolism. It's something to do maybe they're borderline thyroid issues that are going on that are preventing them from losing weight the same way that someone with a normal thyroid can lose weight, and a normal metabolism can lose weight. So, that whole old mantra of calories in, calories out. So much of that is not true anymore. We know that as doctors, we know that in the nutrition world, that you can eat healthy and eat the right number of calories, and your body still has a hard time shedding the weight. And there are people that yo-yo even after working out. There are people that will do all of that, or they may just lose weight so slowly that it becomes demoralizing for them, and to a point where they're like, you know what, I'm giving up. And they shouldn't give up. And you want to tell them, you will get to your goal. It'll just take a much longer time. But we have other tools now. So I don't think, our tool belt is so much bigger now than it was years ago with the new weight loss peptide medications that are available. I use compounded tirzepatide a lot in my practice. I was using semaglutide. I find the tirzepatide, which is a dual receptor agonist, so it's a GLP-1 agonist and a GIP agonist. It works on two receptors at the same time. It works on the brain. I mean, all these medications, at the end of the day, what causes cravings? What causes us to, binge eat or, grab that bag of potato chips and not be able to just eat a couple? We want the whole bag. Or if we have a sweet craving, peri-menopause is a time fraught with a lot of cravings. And it's the body's sort of in this like fight or flight response almost. It's a very inflammatory state to our bodies a lot of times. And we start putting on weight. Anything that causes inflammation in the body will increase, because it's our bodies in fight or flight are in survival mode. And so our ancestors, when they were in survival mode, needed fat stores in order to get through those times of famine or the cold, when they're not able to grow their crops, and they have to have stores of things. Well, we don't go through that anymore, right? I mean, a normal person in today's developed countries, we don't need all that extra fat. In fact, we have the opposite problem, right? So much obesity, so many people overweight. And so that seemed a natural addition to my practice, where even people that were doing all the right things and not being able to lose the weight, a lot of times would benefit from those medications. Because if we look at obesity in the same way we look at high blood pressure, high cholesterol, as a disease process that's happening in our population. Why are so many people overweight? I mean, a lot of it is the exposures to toxins. Going back to what I mentioned earlier, detoxifying our systems helps a lot. But it is a defense mechanism that our bodies hold on to weight, and the weight gain in the mid portion of the bodies through in perimenopause, which women can do everything right, but the weight still comes on in the midsection and around the visceral fat, which is the really unhealthy fat and leads to things like heart disease and cancer and all those other bad things. So losing even 5 pounds of weight on somebody's body changes their metabolism in a way, changes the metabolic functions of their bodies in a way that even that small amount of weight losses can be very beneficial to them. So if they can get into an ideal weight, they can move better. Your joints work better. So people that are overweight, they're struggling. Let's say they want to be exercising, they want to be doing all those good things, but then they put such a strain on their joints that they can't do it as much as they would like to, right? So if we can get them to lose that 5 to 10% of body weight, even that will make their movement so much easier. And so they end up being able to do more then
more motivated.
Yes. And it becomes a good cycle instead of a vicious cycle of like fighting it, right?
Because you see like results. So you just want to keep going.
You want to keep going.
However long to get there. So you want to, keep moving forward.
And I'm very, very conservative when it comes to weight loss. I want to do it slowly for them because I don't want them to gain it back. People that come to me have already tried so many things, Weight Watchers and other programs. And Weight Watchers is great because people do lose weight on it. The problem is that they somehow don't maintain it. And so people ask me all the time, like, well, do I have to be on these medications forever? Is this going to be something that, for the rest of my life? I really believe that these medications at the root of how they work is the blood sugar control. And so going back to what I said earlier about maintaining a good blood sugar helps maintain good health. And so if these medications are what keeps somebody on track once they've reached their goal weight, and just is that added benefit, because again, they work on the brain, they work on our cravings.
Right.
And if we don't have those cravings to that same degree, we're going to be able to make better food choices. And then, everything else kind of falls into place because nutrition plays such a big role in it. And you're going to be choosing healthier foods because you're not craving all the, the carbs and the salty foods and the sugar and all those things. So, and the way I do, there are so many weight loss clinics out there. I mean, every other corner has a med spa or somebody doing these things. As a doctor doing this, I really want people to be healthy through it. There are a lot of side effects that can happen, adverse effects, things like pancreatitis, acute cholecystitis, your gallbladder attack, forming gallstones. My goal in weight loss is to do it in as healthy a way as possible and to do it in a long-lasting way as possible. So I don't want anybody, a person comes in, I don't want them losing weight quickly because you know what rapid weight loss does to a person's body? If you actually look at what's going on in the bloodstream is they're circulating a lot of toxins. When we lose our fat stores hold toxins in. So if you're losing weight very rapidly, people actually feel sick. And so you want to lose it slowly, a pound, maybe a pound and a half a week when they're in that actual weight loss, phase, the weight loss phase of the program. We want them losing slowly so that they can equalize. And I want them losing fat, not muscle. If someone loses weight very rapidly, they are mostly losing muscle. And, I tell all my patients, especially the 50, 60-year-old and older, muscle is longevity. Muscle is long life and health span. So the more we can hold on to our muscle, and I tell my 25-year-old daughter this, that she does Pilates, as I mentioned earlier, you need to hold on to your muscle because that's what's going to get you through the older age groups and stay healthy.
Wow. I read somewhere that even if you're not hungry in the morning, you should at least have like a little snack until you are hungry or like later that morning. And I'm assuming that has to do with like having your blood sugar not spike. So you're probably not like binging and eating like everything in sight, and B, to stabilize and your metabolism.
Right. So for some people, it's so individual, and I go with what the patient really needs, and I listen to what their lifestyle is. So for me, I do intermittent fasting. I don't eat before noon.
So I was going to ask about that. So,
yeah.
So you do believe that, and that works?
Not for everybody.
Okay,
so that's what's important. There are some people that actually do very poorly with intermittent fasting. They're the ones who become hypoglycemic by not eating in the morning, for instance. But you can change your 8-hour eating window to any time of day that works. So if 9 to 5 works best for you to be eating, you eat in that 8-hour time period, and then the rest of the 16 hours is your fasting time period. That works great. For me, 12 to 8 works great because it actually is awesome. Even on the weekends, if we go out to dinner, and you're planning on eating later in the evening, it still fits into that. So I made, on Saturday, if I know that we have a party, I won't eat till 2. And that way I can go till a little later, till 10, and still be able to eat and stay in my eating window. So I think combining things like these peptides for weight loss with intermittent fasting based on that individual's needs works amazingly well for people. It's
interesting.
And they can, and once they're not in that active weight loss time period, they can still maintain and use that 8-hour time, of eating as a way to maintain their weight. So
okay.
But you're absolutely right. For some people, they need that morning. So especially teenagers, they're going to school, and in the morning they're like, I don't want to eat anything, but I feel nauseous. Sometimes I've heard so many people will come in and they're like, they have a history of having, become hypoglycemic and passed out in school or something because they didn't eat anything in the morning. Well, those people need to be eating earlier, and they should not be waiting till noon to have something to eat and make sure that their blood sugar stays stable.
Oh, wow. So we were chatting a little bit earlier about the prevalence of now weight loss and the Ozempics and the lots of people are being treated and not necessarily going through the right steps to be able to make sure that they're a good candidate for that. So what are some, cautionary tales, like things to be wary of and to keep in mind if you're a good candidate for, is it the semaglutide and all of the...
Yes, the
right.
semaglutide is one type of, which is, the brand name is Ozempic or Wegovy, and then you have tirzepatide, which is Mounjaro, and Zepbound are the brand names. Zepbound is just a newly approved form of tirzepatide that is on the market now, specifically for weight loss. So it's really, really important to get a good history on those people, on patients that are interested in it, whether they have a family history that may preclude them from safely taking the medication. So, I do a big intake on those people, but also their own, what is their BMI? So if they have a BMI over 28, for instance, so, we look at their weight to and height and the ratio, and depending on where they fall on the BMI map, are they a good candidate for it? If someone just wants to lose like 5 to 10 pounds because they're struggling to lose that weight, and they have and their BMI is under 20, under 28, and they have no other risk factors, their blood sugar is normally controlled, they really shouldn't be on these medications, because there are some adverse effects that can happen, and there are some side effects that they can be dealing with. So I don't think, taking these medications as a quick fix is the right way to approach them. They are a great tool in addition to the proper diet and all the other things that we use. But let's say somebody comes in and they are 30 pounds overweight, their BMI is, 30, 32, whatever it is. And they've really tried hard with everything else. They're eating, a clean diet, but they're struggling with the cravings and so nighttime eating and those kinds of things. They would be a good candidate for it, assuming that they, qualify based on their medical history. And so, I do blood work on them first to begin with. We want to know what their things like their hemoglobin A1C, what their blood sugar control over time is. That's what hemoglobin A1C checks. Your fasting glucose is a snapshot of what your sugar is that morning without having eaten. That's one value. But a hemoglobin A1C looks at a broad value, like the last 120 days on average of what their blood sugar has been doing. And so that gives me a really good idea of whether, they're a good candidate. And anybody with blood sugar issues can really benefit from these medications, especially if they're overweight. So they will normalize blood sugar and not let it spike the way that they may normally have some issues with blood sugar control, whether it's hypoglycemic episodes or hyperglycemic episodes where their blood sugar goes too high. And so we look at all of that, and if I need to, I follow their labs. Once their labs come back and they're cleared for basically starting the medication, we're very careful. I guide them on, proper amounts of protein, proper amounts of hydration, because you want to prevent those potential side effects like pancreatitis, cholecystitis. People can develop a lot, other issues. Now stories are coming out with people developing small bowel issues, they're not, or severe constipation. They haven't gone to the bathroom in days, and no one's guiding them a lot of times. They go and they get the medication from one of these med spas or whatever, and they have no other guidance beyond that. And that's what's scary out there. I think that, we see a lot of that.
Is that why they're developing that, like what they're calling the Ozempic face? Like no one's guiding them, and then they're rapid weight loss, and then they look like gaunt and like that.
Yes,
okay.
Yes. And now they look so aged, and you're like,
you're thin, but the one problem about losing weight, like the only problem really, is that it shows like more fine lines, and you look like
and that
drains all the collagen.
And that's that's such a big part of it, because I actually. Most of the, I see men and women for weight loss, but most of the time it's the women that will ask about that. Mm-hmm. Oh, I've lost the weight and I feel great, but what about now my face? I feel like I see more wrinkles. And I love talking about that with them too, because, there are other peptides. Collagen peptides is going to be like the number one friend to those people that are losing weight to take regularly, because even though the collagen is such a big molecule, and when you're taking collagen peptides, they're not magically going into your skin. Your body has to break them down. The amino acids then reform collagen in your system.
And it builds up over time, right?
Exactly.
Yeah, right.
And so over time, that collagen peptide that you're taking in regularly will help your hair, skin, nails. And so that I tell them right from the beginning. I have a whole list of supplements that I recommend. I make sure people's vitamin D levels are optimized. If your vitamin D levels are not optimized, you're not going to be able to lose weight. So that's actually a pearl that anybody wanting to lose weight should know what their vitamin D level is. And, if it's not optimal. You can't make hormones. Vitamin D is actually a pro-hormone. It's not a vitamin. It's, really mislabeled as a vitamin. You can't make your own estrogen and all your hormones, and you need it for cholesterol production. We hear cholesterol as the bad thing in the body, but the cholesterol is so necessary for so many functions in the body. And so in order to make good cholesterol, sorry, that's rumbling my stomach, you need vitamin D for that. And so I optimize their vitamin D levels. I make sure they're taking magnesium. There are just a lot of things that we put into the protocol to make sure that people are successful at, their weight loss journey, and that they don't end up with that, as like you said, the Ozempic face, which, is a big issue for rapid weight loss.
Yeah.
You have to really be careful with that.
The collagen peptide is something that's prescribed, or is it you're talking about supplements that you can buy?
And yes.
So are there better ones? Like I take one and I think I'm actually going to stop taking it because I'm like, it's been like months and it's expensive. And I'm like, I don't know. I don't really see much of a difference. But what do you look for when you're getting, can you buy the one from Costco? Like that's
Costco has some great brands.
Okay.
Like they'll do a lot of organic brands and things. So yeah, I mean, it's not that it's good or bad, but you want to read the label and make sure that the source, what the source is. So, there's bovine sources, which is from cow. You can get, there are a lot of different brands that are really good. You just want a clean source. Look at with the cows how are they raised, basically, and they'll talk about third-party testing on the label a lot of times.
Oh, wow.
Most of the supplements that I recommend are all third-party tested. I don't want to have my patients taking things that we don't know. I mean, there was the big scandal in New York City years ago, or New York State rather, where they found garlic and ginger and things in supplements that were labeled, B12 and other vitamins. So it was a really big.
Oh wow, I didn't know that.
Oh, it was a huge thing, and so ever since then, companies started, reputable companies started getting third-party tested and putting that on their labels. So if you're buying something, make sure it's third-party tested, whatever it is, so that what's in there is what they say is in there.
Oh, interesting.
And that's important because, it could be labeled whatever it is that they're selling, but you don't know if that's what you're getting.
Yeah.
So
we next time come back on and we'll talk about FDA regulations and food and stuff, because that would be it's so interesting to me. And there's a lot of there's so much information out there, especially with social media. It's good. This is my career, but and a vehicle to bring information to and resources to the community. But at the same time, there's a lot of information that's not guiding you in the right direction. So what to eat is always I think so interesting to so many.
Oh yeah, and I think what you eat is such a big part of anybody's health. If you tell me what you eat, I will tell you. What I think where your health is. And I think that's true for most people, that it makes a huge difference.
So interesting. So we chatted a little bit about where you're from in the beginning, but we didn't talk about your mom of 3.
Yes.
And you live in Toms River?
No, I live in Marlboro.
You live in Marlboro now?
Yes,
okay, got it.
So I work in Toms River and West Long Branch, but I live in Marlboro. I have 3 children. My eldest is 25. Anjali, she's a medical student, second year, going through the exams and everything right now. My middle one is 20, Anisha. She's at Tulane in New Orleans.
Oh, I have a cousin who goes there.
Oh, she loves it. And it's such a great school. I mean, even just the school spirit, the
yes.
Families. My older one went to Emory, and I feel like we loved Emory, but there was not that family school spirit of I am from Emory. For the Tulaneans, it's this big part of their life.
I don't know if you remember last year they were it was one of the games,
and
there was Tulane girl.
Yes.
That's my cousin.
Oh my God.
Yes.
Oh my God, she's famous. Yes. Oh, that's amazing.
It was very funny.
Yeah, that's very cool.
Yeah, she was all over ESPN, and then someone else picked it up, and it was funny.
That was
her.
Huge on social media. My daughter sent me something about that.
Yeah, that's her.
Yeah. And then my youngest, Akshay, he's first year freshman at University of Miami.
Oh.
He's doing the whole frat thing right now, which makes me very nervous, but he's loving it. I mean, they're both schools are really amazing schools. And
that's great.
Them.
Do they know what they want to do yet, or not really?
No, but definitely not medicine. Both my husband and I are doctors, and my eldest one always, I think she always wanted to be a doctor. She never really had other ideas in her mind, but the 2 younger ones are my middle one maybe law. My youngest is all about money, so he wants to something, and he's at the business school. So we'll see what they do with that. They're still young, and but as a new empty nester, I talk to moms all the time, and my favorite people are moms. I mean, my patients, like I love to connect with them on that level as well, because I feel like it's such a big part of our lives, right?
Yes.
Being a mom and my identity, like it took a big hit when I became an empty nester this past August. I was like, okay, so I'm still mom number one, but not every day. Like
Yeah.
I can't, I get on the phone with them and we, FaceTime, and we have our calls regularly, some more than others, depending on the child. But that was tough. That was a tough transition to try to figure out, like, how do I identify myself? So I started playing pickleball. I started Pilates. I like hot yoga. There's a bunch of things that now I do for myself.
That's great.
Just because I think that, staying vital and as healthy as possible. I want to be around for my grandkids,
Right.
And I know we're not
Right.
we're not there
No,
yet,
not yet.
but still, like, that's the goal.
Right. Yeah, we were chatting a little bit. My son also moved out, so I still have my daughter. But yeah, it's strange because it's you when you're in the thick of it, you're like, oh, I just want more time for myself a little bit, like selfishly. And then all of a sudden it's just fleeting. And they're like, my son very much surprised me and got his own place and stuff. And so now I don't know. I mean, maybe one day he'll come back if maybe he wanted to change careers and needed to stay or whatever. He's local.
Okay.
So he came over for dinner the other day, and I talked to him. I bother him like all day long. He'll call me, like, usually it's like, what's our car insurance thing? Or, when they need something.
Boys call for specific things they need, whereas girls just call to, chat. And
totally.
And it's the dynamics is so interesting between boys and girls.
It is.
And I love it. I love that they're so different from each other. And, and they were raised in the same household. How did that happen? Right.
So different. Oh, my two kids could not be more different. It's very funny. And same thing. I can't imagine my daughter would ever, like, she's attached to me now. I don't, hopefully that doesn't change in her teens, but
I feel like they leave for a bit in college where you don't, maybe the interaction is more limited, and then they come back. Like my older one, she's always, like asking me for recipes and like, oh, what do you think of this supplement? I'm like, okay, we'll talk about that.
Well, that's great. You have a great resource for her.
And she's really into her health now because she had, acne and other issues growing up. And every time I would tell her what I felt she needed to do, and, it would go in one ear and out the other. And now I feel at 25, she's really starting to embrace that mom can actually help her, and kind of listening to me, on that front. And I love that we can have that conversation. And I also love talking about, random medical things with her, which is so cool because I grew up in a family of non-medical people. And so I didn't have anybody. Then my brother also became a radiologist. So we had that connection. And, my husband's a doctor. Now we have a bunch of doctors in the family. But growing up, I didn't have anybody to discuss any of those things with, or even when I was in medical school, it was like a void. And so now she'll tell me about certain things and certain whatever she's learning. And I love hearing about that. So it's cool.
That cool. Is your plethora, so much knowledge and so interesting to learn from. So thank you so much for coming on.
Thank you so much for having me.
Where can everyone find you?
So my website, Juvenate Medical Wellness and Rejuvenation, you can find me there. We have a Facebook page. We have an Instagram as well. And anytime anybody needs help, you can always call us and make an appointment, come in and see me. And I love working with women, especially. I'm not trying to downplay, men need help as well, but they're so much less willing to get it. And usually they're pushed by their wives, whereas women seek out help. And I feel like, at a certain stage in life, when you've raised your children, maybe when they're a little older, you can focus on yourself and your health. We're always the last ones we take care of. When you can take care of yourself at the forefront, actually your whole family does better for it. So when we're healthy, they're healthy.
Yeah. Well, I forget. I was having this conversation, I think, yesterday with actually a local attorney, and we were talking about, she does family law. We were talking a little bit about that, and not so much, from a health standpoint, but just how if you are taking, good self-care, that you show up more, you show up better for your family, and you check that box, right? And you just feel you can be more present, and it's so important.
So true.
True. And I'll continue to talk about that because we're going to talk about that at the summit, and about, just like really making sure that you feel fulfilled from a professional level, from a, for your own health, for your mental health, and the little things that you do each day. Doesn't have to be like, oh, I'm at the gym for 3 hours and screw my kids. I'm never, but just the things that you do over time, can make you a better mom and, feel better.
Absolutely.
from the inside and out. So thank you again for coming.
Thank you so much for having me. This was great.
I'll link everything on the chat, on the text here, so you can access her website and hopefully call and make an appointment and learn more.
Thank you.
Coming up, we just launched our Valentine's Day guide. So we have all kinds of local events that are happening. Valentine's Day is like really evolved over the years. And I kind of like where it's come, where it's kind of not so much focused on just the partner in your life, which is great, but also like kind of the season of love. So Galentine's Day events, there's lots of cool things that you can do with your kids to show them that you love them and care about them, and can spend like a family day date, right, of all kinds of activities. So we have really cool local events that are happening, and then also activity ideas. So if you wanted to do like indoor mini golf and then maybe go get pizza at a great place, so we have lots of family-friendly restaurant ideas in there, and then also things for date night too, adult-only events, and things to do with your friends. So check that out. We also are launching our newborn and littles guide soon. So mommy and me activities, if you've just become a mom or a mom again, different resources in the community, doulas, night nannies, classes, just different things that are available to you at that stage of motherhood. And then, like I said earlier, we're going to chat about the summit soon. So stay tuned for that. And there is lots of information about the summit now. We have a preview of our lineup of speakers, panelists, vendors, networking opportunities, and more. This is not just for the mompreneur. This is not just for the working professional. If you are home and looking to re-enter the workforce, or maybe enter the workforce for the first time and really don't know where to start, we are going to have resources available for every mom in our community. So really excited about this, and stay tuned for more information. That's Thursday, April 11th, here at Bellworks, because this is basically where I live. And thank you again. All right, guys, see you soon.